Okay, so now I'm recording lecture 6 uh, for this course 4191. So we take a look at a Pyxis machine used in pharmacies, right? So this is a machine that is used to dispense drugs and store drugs. The reason why they use this machine is they know exactly who retrieved how much medications of what type, at what time, for whom, everything. This is kind of like an automatic accounting or type of inventory system that is used. The reason why Pyxis machines came to existence is because bookkeeping becomes that much more easy, and these days with opioid crisis and people getting addicted to some kind of drugs and all that, there is a need to maintain accountability. In a Pyxis med station, it's kind of decentralized. It involves barcode scanning so that you can use medication dispensing. It's automated and all those great things. You have a robot RX automated medication system which is used to fill these Pyxis machines with drugs and restock them and all that. So there's a picture of that machine. So it dispenses patient-specific type of medication, supports cabinet restocking, stores more than 25,000 medications and all that. We're talking about Robot RX, sorry. And then it can accommodate different types of medications like tablets, capsules, syringes, vials, all those things. So that's the beauty of this automated system. Robotic medication dispensing provides real-time enterprise-wide picture of medication stored. You can access information on what kind of medications are stored and what need to be restocked and all that remotely, and integrates with some of the existing systems for the purpose of restocking. Fulfill RX is one of them, and then you have hospital pharmacies minimize medication-related expenditures. You don't have to hire so many people. Sometimes these machines, if associated with robotic movement, can move from one place to other within a hospital all by themselves. So these type of things can happen. Next, we move on to robotic surgery. Robots being used in surgery has been in place for a while, but now it is getting more and more popular, especially with remote surgery, where a surgeon is sitting somewhere else and performing the surgery on a patient in a different location. Of course, robotic surgery does involve some human involvement. It's not a great idea to make it completely robotic. So there are supervisor controlled surgical systems where you have a supervisor controlling the system. It's not like fully automated because we want to be careful dealing with human bodies. In a supervisor controlled robotic system, the surgical system offers high level of automation, but then there are certain things where it's like autopilot, where the pilot can take the plane back into manual mode if required. This is how supervisor controlled surgical systems work. Then you have shared controlled robotic surgical systems where the robot assists the surgical procedure, but some of the tasks have to be performed manually. This keeps it safe. So it leads to the idea of active constraints, where the surgeons recognize that there are areas forbidden for the robots to work on, and they work on these tissues themselves. So, as I said, telesurgery is becoming popular. In telesurgery, the surgery is performed from a remote location, and robotic arms and all these things are used. They are pretty effective for small incisions, but if you are doing some real critical surgery like open heart surgery, telesurgery may not be the best option. This is an example for Telesurgery System. You have robotic radiosurgery systems these days, where medical imaging first locates the tumor, and then a series of commands are then entered by the physician to destroy those tumors. So that leads to the idea of telemedicine. Telemedicine is the use of medical information exchanged from one side to another via electronic communication to improve a patient's clinical health status. Right? That's one of the definitions of telemedicine. Telemedicine could be implemented using different devices, smartphones, emails, two-way video system, wireless tools. Can your tablets be used for telemedicine? Definitely yes. Can your iPads be used for telemedicine? Yes, why not? So there are different types of devices that could be implemented using telemedicine. That could be used to implement telemedicine, sorry. So these devices, they can be combined together to deliver telemedicine. However, individually these devices may not be fully used to, or in other words, these devices may not be standalone devices to implement telemedicine. You always need a combination of several devices and programs working between those devices to implement telemedicine. So these days reimbursement is allowed for telemedicine, so insurance companies are coming up with some kind of arrangements where telemedicine could be reimbursed, or healthcare delivery using telemedicine could be reimbursed. And telemedicine is closely allied with health information technology, which these days we are going all electronic on healthcare data. So some of the services provided by telemedicine includes primary care and specialist referral services. So if you go to a primary care doctor and he refers to, or he or she refers you to a specialist, the primary care coordination could be done using telemedicine sometimes, right? That's one of the ways of doing it. Especially telemedicine is very useful in rural areas. Going to that point, we can talk about remote patient monitoring, where a patient could be monitored using a particular facility and the physician could be in a remote location. This is especially true in a situation where in America we don't have the number of physicians that we need. Especially healthcare in rural areas is a much needed thing, and there are not too many hospitals in rural areas, not too many physicians. The reason why there are not too many hospitals in rural areas is because it's not profitable to have a hospital in a rural area. I know about one particular business that closed down because they were having difficulty finding trained personnel or trained staff work in their facility in a rural setting, finding patients who are covered by insurance or by Medicaid or Medicare could be a challenge sometimes. I was talking to a doctor once who told me that this guy was an oncologist, and he told me that he only saw 2 patients that day, and this is in rural northeast Louisiana. One of them, both of them were covered under Medicare Part A and not under Medicare Part B, which means he provided free service that day. He was not going to get paid by CMS because they were only covered by Medicare Part A and not by Medicare Part B. All right, so this is a situation. So telemedicine can help in these type of situations. Medical education can also be provided using telemedicine. You can get continuing education credits. Telemedicine is, as I said, is delivered using programs across devices. So you definitely need reliable high-speed internet connection to implement telemedicine. Point-to-point connections are situations of where you have a particular device connected to another device remotely, directly via a particular transmission media. So those are like point-to-point connections. In point-to-point connections, the transmission reliability can be very high, whereas if you use a shared medium, then transmission reliability could be a problem. For example, if you're using a freeway, that is shared by everybody else living in the city, then there is a very good chance of traffic jam. But if you are using a toll road, the chance of traffic jam is much lesser because people who don't want to pay money are not going to use toll roads, right? So in point-to-point connection, the reliability is high because of the network traffic being low. It may not be the case all the time, but the chances of reliability is higher. You have monitoring center links. You have wireless mediums that are, can serve as a hub and those type of things. If you have like a telemedicine network, then you need to have some kind of a monitoring system in between. So these days, web-based e-health patient service sites are also in use, where telemedicine is implemented using internet. So some of the benefits of telemedicine include access, as I said, especially in rural areas where there was no access or there's no access to some kind of healthcare facility. Telemedicine would be a solution. Not all the time, but many times. I say not all the time because I remember taking my wife to the delivery room when she delivered a child. There was it was like 3 a.m. in the morning, and there was another family that traveled. We were just like 15 minutes away from the hospital, and there was another family that traveled like 1.5 hours to get to the delivery room. So, luckily, both the mother and child were safe. So, telemedicine may not be the option all the time, but it does help in many cases. You have cost efficiencies because, one doctor I know, he used telemedicine because he didn't have to travel between so many clinics. He could sit in one place and take care of patients remotely, especially for chronic diseases like cancer, reduced travel times, shorter hospital stays. All those things can come into the picture by using telemedicine. You can sometimes have improved quality using telemedicine, because if you have quick access to the physician, then the quality can improve tremendously. But then you also need reliable connection. You need reliable devices. You need to know how to use those devices. Another example I can give you is if there is some kind of sensor that a particular patient may have in his body, and that sensor is connected to a remote monitoring system, which is connected to a doctor's office, then you have a real-time healthcare delivery process in place. There's a patient demand for greatest impact of telemedicine is on the patient, the family, community. If the elderly person in the family has a heart problem and there's a heart, some kind of a sensor device that detects the heart rate on that particular person. If the person is having a heart attack, went for a walk, had a heart attack, fell down, nobody would know unless some pedestrian figured out that this person is lying on the ground, right? But if there is this monitor that picks up the difference in the heart rate and sends the signal to the monitoring system somewhere, and some individual from the monitoring system picks up the phone and calls the caregiver, that's much better, especially for patients with dementia. They have, there are these cases where people with severe dementia, they walk into someone else's room and end up sleeping on someone else's bed, thinking that they are in their home, and this person who owns that other home opens the door, walks into the bedroom, and they figures out some old man or old woman, sleeping on the ground. I'm sorry, not on the ground, on their bed. Then they call the police. They freak out. They call the police, and then the cops come into picture, and they figure out this older lady or older gentleman is actually a dementia patient. So these things have happened. So having like a monitoring device on the patient can help figure out where the person is, and hopefully help caregivers identify where they're located and all that. So in many cases, people with these monitoring devices, the caregivers already informed the police department that here's an elderly person with dementia, and there's a possibility that this person may be lost and may be wandering around, and here is the identifier to the device connected to this person. So those things can help a lot. Alright, so that's the end of lecture 6. I hope it was a little bit informative.